Hello, I'm Stamatia Destounis, and I'm here to speak to you for the next few minutes regarding workflow solutions to keep our patients safe during COVID. I'm from Elizabeth Wendy Breast Care in Rochester, New York. So during the pandemic, with the arrival of COVID in the United States, all non-emergent imaging paused, including most of the breast imaging services that we provide. The practices around us and ourselves have had to navigate new workflow, new patient management and procedures to keep provider staff and also the patients safe. Depending on size, location, and resource levels, this can be quite tricky to figure out how best to move forward. Our practice is an outpatient breast imaging facility with 6 satellite offices covering a 200-mile radius. Pre-COVID, we saw over 100,000 patients between all our offices per year. During the COVID pandemic, all patients were canceled mid-March, and our offices all closed in order to prepare our staff and our offices for social distancing, to obtain PPE and all the sanitary things that we needed to be able to clean all the surfaces to keep our staff and our patients safe. Some of the scheduling changes that we saw were such as this. If you look at our scheduling for 2019, in the month of March, we had over 8,261 patients. In yellow, you'll see that in 2020, in March, that became half of it because we did close the offices. In April, our volume stayed very low. Between last year and this year, 2019, 2020, in April, we saw only 2,000 or so patients through all the offices, predominantly diagnostics, and much less than we had seen the year before. The same for May. Our volume continued to stay low, although we continue to see diagnostic patients that required care. So we developed an automated process so patients receive an email or a text or a phone call to confirm or reschedule their appointment. Typically, this happens 2 to 3 weeks prior to the appointment date. They're given 48 hours or so to respond to our message. If there is no response, then that appointment is auto-canceled, and a text or an email, whichever way the patient preferred to be contacted, or a phone call is sent out to let the patient know that as we did not get confirmation, we're canceling the appointment and to call our facility to reschedule. Initially, you saw that the volume was drastically lower in March, April, and May, although by May we started to pick up a little bit. Additional scheduling changes that we made was to use our satellite locations much more. Since we have several, we've been able to spread out the volume in order to continue with social distancing appropriateness and safety, and also continue to be cleaning every surface. And as we've increased the appointment time between patients, so not to have too many patients in any one area, we have slowly been able to increase our patient volume. And you see here, now these are the last 2 months. I showed you before March, April, and May, and this is now June and July, that you see that in June, the green is last year, and the yellow this year were about the same, a few hundred patients less, and now in July, we've actually increased the number of patients that we saw this month in comparison to last month. We do have quite a backlog of patients from the time that we were closed in March, and also our volume was very low in April and May, and we're going to be trying to add those patients in August, September, October, and to the end of the year between our satellite offices and also between the expanded hours that we have implemented at every office, starting earlier in the day and ending later, and also offering Saturday appointments to be able to catch up with the patients that are waiting now to come in, and also to continue to offer care to the patients calling. We pre-screen all our patients for the symptoms of COVID during the scheduling process on the phone and also upon their arrival. And we also do daily health screening of all our staff, which is required. We submit through an app to the ROC COVID, which collects the information for the community of Rochester and surrounding areas. So all our staff has to fill out this app with all the questions regarding any symptoms for COVID. And they also have to attest through another app that we have created. So our own facility has the same information, and that gets all submitted to our HR department. So the waiting rooms have changed. Our front desk has changed where we greet the patients, where patients wait for their mammogram has changed. We, in the main waiting room, and the entire entry has been redesigned at all our offices. There are markers placed everywhere, and there are lanes created to promote the social distancing and maintain safety for everyone. We have a patient greeter at all our facilities that monitors every patient entering the building. If the patient comes in too early for their appointment, we're asking them to return to their vehicle until their scheduled time, and we will text them when to come in. Companions are not allowed unless a minor or require assistance by an aide. Our hallmark for Elizabeth I Breast Care has been that we offered patients results the same day. Currently, we cannot offer that exactly the same way because the patients cannot wait in their offices for their results. But we're still providing these same day results by text or email, typically within a few hours of the appointment time. We're able to create this program that as soon as the radiologists interpret the mammogram, a message gets sent along with a mammographic report that gets created and along with billing, and then texting goes immediately through this app to the patient so they know that the results are okay as quickly as we can get it to them. We've created new positions in the office in several areas to promote the social distancing and the safety and cleanliness. But also we created a position regarding the patient results coordinator, and that person manages all the results and contacts the patient if they need any extra views to come back and schedules that patient for that follow-up callback appointment. Our patients are very happy, and we're getting surveys online and on paper and through calls that they're very comfortable with the new procedures that we have in place for COVID now. And they tell us the staff is quick and prompt, remain friendly and informative as always. So managing this new landscape will be difficult for all of us, for radiologists and for our office staff. It's important to maintain your level of care for the patient through this and to ensure patients' safety and ensure that they're comfortable through it all. So in summary, as a medical provider, it's important for us to do everything we can to keep our workplace and our community safe. And we rely obviously on all the national and local guidelines and to stay abreast of any of the changes that are frequently occurring. We're flexible in making changes to these workflows to meet the changing public health situation. And obviously, some changes that have been made are likely to remain in place long after the pandemic subsides, such as the cleaning protocols, the PPE, and some of the others will be relaxed gradually. Our app that we've created in order to inform the patient of their appointment and also cancellation and rescheduling and also the results has been very, very helpful for us. I want to thank everyone for your time. This is my email address if you have any questions in anything I've said. And I hope you have a good day and stay safe. Thank you.